I'm a nurse practitioner in urology and urology oncology. Today I want to talk about urinary tract infections. I have so many people coming up and asking me questions all the time, which makes sense considering that by the age of 32, 50% of women are going to get one. So this is extremely common. So let's talk about it, get you on board so you know how to take care of it in the future. First of all, I'm going to talk about premenopausal sexually active women who get urinary tract infections. This is actually quite a big topic. There's many different areas we are going to discuss in future talks. I'm going to talk about post-menopausal urinary tract infections, vaginal atrophic vaginitis. We'll talk about urinary infections in men, but today we're just going to focus on sexually active premenopausal women. So I want to talk about the reasons that young sexually active premenopausal women are so prone to getting urinary infections. If you look at the female anatomy, it's pretty small compared to the male anatomy, right? So that urethra is about yay big. And so bacteria are more prone to get into the vaginal tract and then can cause urinary infections. That's reason number one. Another reason is, being sexually active can certainly increase risks of getting the bacteria into that urethra. The more sexually active you are, the more likely you're going to get a urinary infection. If you also use condoms or certain spermicides, that can also increase your risk. And of course, genetics is always going to be a factor in a lot of things, as well as urinary tract infections. Okay, so those are some reasons why women are more prone to getting them. And so what are the symptoms? And sometimes people say, I don't have any symptoms, I was just told I have bacteria. So I want to be very clear, that's not what we're talking about today. Today we're talking about actually having symptoms that you feel. And let me tell you, if you've had a urinary tract infection, you will know. So we usually call it a triad of symptoms. The most common are frequency, urgency, and burning with urination, also known as, in medical terms, dysuria. A lot of women will tell me I have tons of vaginal discharge, and I'm going to tell you right now that's usually not associated with a urinary tract infection. Okay, the big ones: frequency, urgency, and burning. That triad right there, there's a good chance that you're going to have a urinary tract infection. So what do? Do you write it out? And there have been some studies showing that actually if you drink tons of water, you take ibuprofen, in some cases that can push it out. However, the majority of women will tell you, I'm not going to wait, this is pretty uncomfortable. So for those women, the majority of women, what I'd say is, yes, you can get an antibiotic, go to your provider, and they can, even probably over the phone, give you an antibiotic. The pretty typical ones I'd say are Macrobid, Keflex, Bactrim. Those are all very common. I usually would stay away from Cipro. It's a great antibiotic, but it's so good that it gets rid of the good and bad bacteria. So the most common ones are the Macrobids and the Keflex, Bactrim. And, the courses usually can be 3 to 5 days. Again, leave that to your provider. If you're really uncomfortable, there is a interim Band-Aid fix, and this is just a Band-Aid fix. You can go to Walgreens or CVS or any pharmacy and buy over-the-counter Azo. This is another name for it is phenazopyridine. This will make your urine turn orange, so just be aware of that, and that's perfectly fine. This can help. It's a bladder anesthetic released directly in the bladder. It can help with some of that burning or irritation, kind of calm things down a little bit. But really, the antibiotics, should do the trick. Okay, and again, I want to emphasize this is for a simple urinary infection. This is not a complicated urinary infection. This is not where you have symptoms of nausea, vomiting, fever, chills. Those are all more concerning for what we call maybe a whole body infection or even a kidney infection, and that's a totally different topic for another time. Specifically for localized, simple urinary infection, these are the things you want to do. Moving forward, to prevent, drinking lots of fluids. Hydration is always going to be a great thing to do, and especially if you're sexually active, making sure that right after you have sexual intercourse, you urinate or you drink fluids or you wipe well. These are not grounded in a lot of strong research, but some people, have anecdotally said that they can help. Okay, the same thing with cranberry juice. There is some research out there, although not super strong, that says it can help. D-mannose is another. So these are all D-mannose and cranberry. You can certainly buy over the counter as well. Cranberry juice, though, be careful. You don't want the one with the sugar. If anything, that's just going to make your urinary infections worse. Okay, so hopefully this gave you a little overview for simple UTIs and how to manage them. Take-homes are, it's extremely common. Most women in their lifetime will probably get one, and there's a lot of potential ways to manage it. So hopefully this was helpful. If you have any comments, let me know. Until next time.